Hi, welcome to my channel. This week's topic is going to be skin infestation with scabies. I hope this three-part video will be helpful to you. I know scabies, mites, bugs are really a difficult topic. I'm hoping to shed some light and some hope in your journey to wellness. I'm Debbie, registered nurse with 30 years clinical practice experience, and I want to talk to you today about a skin infestation called scabies. Scabies is a physical and emotional issue that affects people who may not really know what they have. I know from personal experience over the past 6 months, my family and I have had scabies. Scabies, it's called Sarcoptes scabii. It is a microscopic skin infestation. You can get scabies from anywhere, from wearing shorts on airplanes, from seats, from prolonged contact. Scabies don't jump or hop like head lice. They don't live more than 4 to 5 days off of a host. You will see varying information on scabies, but I have experienced it and my family has experienced it. So I want to go through diagnosis, treatment, how to get rid of the little buggers, and how to get you through something that is emotionally and physically draining. So when you first feel an itch, think nothing of it. Maybe you have itching on the palms of your hands and the soles of your feet. You get a rash that looks like hives or pimples. Then it starts to spread. The most telling thing about scabies is at night, it is an incredible itch, and it spreads. Scabies are caused by mites that have 4 different stages of life. I've gone to 11 practitioners with my 6 family members, and I've had patients that have had scabies. We were misdiagnosed for nearly 3 months. It's important to find someone that believes you and that is really clinically astute in figuring out what you have. I'm going to break these videos into 3 or 4 parts, just because there are plenty of articles and web boards out there that make scabies sound hopeless. It's not hopeless. It's just a matter of knowing what's what and knowing what you're going to do. Anything in nursing or in medical illnesses, as long as you have a plan, you have some hope. So initially, when you get a rash, you go to someone and you try the regular creams. I think the first thing that they would do is probably, especially if you don't know that you've been in contact with scabies, they would probably look at you and say, okay, you've dermatitis, let's start with some steroid creams. Once that has happened, steroid creams didn't work, you've tried detergents, you've tried taking away what you might be allergic to, maybe it's, dish detergent, laundry detergent. Once the rash starts to spread, the most telltale thing about scabies is the little buggers get into your hands. I know personally, I knew I had scabies when they went into the crevice of my wrists. When they're in your wrists and between your fingers, in your nail beds, and in places like your back of your wing bone in your neck, you know they like moist, hot spaces. You have a good idea that you've contracted this mite infection. A lot of times when people hear you have scabies, they flip out. Even practitioners I've gone to, they say, okay, you may or may not have it. Let's give you some cream. Okay, don't sit down in my office. Goodbye. Then you go back 3 weeks, you still have the scabies. They say, I'm going to give you another bit of cream. Don't sit down in my office. Goodbye. So you as an individual, if you're caring for your family member or as a nurse or anyone that's suffering with this infestation, you need to have a plan. The remainder of this video is going to be talking about what to do in order to keep your environment clean, because that's the first step. The plan is to separate the members of your family or house that have the infestation. It'll start off probably in one member and then it spreads through physical contact. Not a handshake, not just a hug, but like prolonged physical contact. I read articles saying that a scabies mite may take as much as 15 to 22 minutes to crawl an inch. But if you have blankets or if you have a pet that may have been in contact with someone who's infested with scabies and you snuggle those things for a prolonged period of time, the scabies will then go to the heat in your skin and they will become part of you. You will be their host. Nobody wants bugs in their skin. But the good thing about scabies is they do not hop or jump, unlike, head lice. So there are certain things, I have a plethora of things I want to go through in the next video of things that can treat scabies. But initially, what you need to do is you need to figure if the rash is not going away with other creams and the doctor is not really sure what you have. I can personally attest to the fact that I have had 4 scrapings and 3 biopsies that were all negative. It is very difficult to isolate a scabies mite. So you may have several negative scrapings or biopsies, but yet still have scabies. If you know you have scabies, there's some basic things that we're going to start with. Number 1, you need to stay away from sharing any clothes, any sleeping spaces, or closed living quarters. You need to take yourself to an area where nobody else in your house sleeps. Separate yourself by bathroom, separate your linen. Get your own linen bag of plastic, trash bag is fine, and then you need to put everything that you have had that's infected in a sealed trash bag, either outside on your porch or in your garage. You're decreasing the number of mites and infestation numbers within your home. That's step 1. Step 2, get yourself some hardwood or linoleum surfaces that you're going to walk on. Pick up any carpets, anything extra in your homes in the way of stuffed toys or pillows. Put them aside, set them aside in plastic bags, get them out of your environment. You need the environment to be able to be sterilized and to be cleaned. Environment cleaning should be either a Clorox-based or a Lysol-based product. You need to spray everything that you touch, including bathrooms or showers, countertops, every day. Even your cell phone. You need to sterilize your cell phone with rubbing alcohol or even hydrogen peroxide. Anything that you're going to touch, that your hands have touched. I know a lot of people will say, oh no, that's not necessary. It is necessary. We suffered for almost 6 months not being able to get rid of these things. So the more you sterilize, think about surgical technique and asepsis. You need to be proficient in separating these little buggers from any feeding source. Remember, one mite that survives can reinfect yourself or your family within 3 to 12 days. The mite's reproduction system is different. Obviously, it's a bug, but you can tell that each mite delivers, pregnant female delivers 3 to 5 mites daily. So even if your environment has 1 mite, within 2 weeks, you're going to be reinfested. So environment is the first thing. You've got to launder your bed stuff every day. I would use borax or bleach. Use the same sheets and blankets that are not very fluffy. Make sure that you put them in a dryer for at least an hour post being dry. Wipe down your sleeping surface. Sleep on plastic, not a regular mattress. If your mattress doesn't have plastic, get it. Or sleep on a surface that is able to be cleaned, like an inflatable bed or mattress. Wipe that down every day with Clorox or Lysol. Okay, and then launder those sheets. So we're talking about decreasing the number of scabies, mites, and eggs in your environment. That is a key thing. If you have a pet, you need to wash him, and you need to keep your pet away from anyone that might be infested. Pets do not support the reproductive cycle of scabies. However, they are like furry mops. So the mites and nymphs of scabies can live within your pet. These are some of the basics for how to decrease the scabies load. I'll go into the next video of what kind of things and what kind of program you need to use. I hope you found this to be helpful, and I hope you'll subscribe, and I hope you get rid of your scabies. Thanks.